You're watching Bringing Better Health to Life, brought to you by Conway Medical Center. My guest right now is Dr. Charlie Sasser, and I've interviewed him several times over the years, and he's just one of the best. And I understand that you are affiliated with what we call the Conway Physicians Group. But before we explain that, tell us about your background.
Well, I'm a Conway native, and I come from a family of physicians. My father and my uncle practiced medicine here in the early part of the 20th century. I received my undergraduate education at Davidson and then at the Medical University in Charleston. Did my training in internal medicine in Denver at the university, and I've been practicing here for almost 36 years.
And we're so glad you have been here for 36 years. As a internist, you do a lot of work with patients of all ages, and you have for years, but your work has kind of widened over the past couple of years.
Yes,
to say
it has.
The least.
It has. I actually have 3 jobs now. Actually, traditionally, internists are doctors for adults and begin to take care of people from ages 18 on. And I've been practicing general internal medicine here since I arrived, returned home with my family in 1974. As things have evolved, I've taken on 2 additional responsibilities. One is to be the medical director of Mercy Care, which is the not-for-profit hospice in this community. And so I've been doing that since about 1981. The other, more recent responsibility is to become the medical director of the Palliative Care Consultative Service for Conway Medical Center, which is a new and upcoming specialty, subspecialty of internal medicine.
And we'll talk about that in our second segment. Let's explain to everyone watching about the Conway Physicians Group, what the group is and how this benefits the community.
The Conway Physicians Group was actually organized upon the invitation of the hospital to meet mutual needs. The hospital realized that primary care is struggling and wanted to make sure that it had a viable and vibrant referral base, and primary care is indeed struggling and is at threat of going away just because of the way the reimbursement mechanisms have shifted over the years. Traditionally, we are paid per patient seen, so it's called volume-based reimbursement system. And we have to see more and more patients each year in order to keep the doors open. And if you are in private practice by yourself or with a small group, you will have to see 30 to 40 people a day, which makes it very difficult to practice good internal medicine when you're having to see people so quickly. And as the population ages, people have multiple diseases and multiple issues and their own 8 to 15 drugs, and they need time reviewing these, making sure that there are no interactions. And so it's just almost impossible to take care of our population of people in a very short period of time. One of the nice things for the future about the Conway Physicians Group is that we are likely to see this volume-based fee-for-service kind of practice gradually disappear. There are too many perverse incentives associated with it, and we will begin to see other mechanisms. And so now, as a salaried physician of the hospital, well, I'm still expected to see a certain number of patients because that's the way the hospital is reimbursed. However, as time goes on, we will see shifts in that, and the hospital and the physicians will be in a great position to respond to those changes that are in our future.
Sounds like that will benefit everyone.
Right. It really is a very nice marriage, if you will.
We're going to take a little break here, but when we return, we're going to address the topic of palliative care. What is that all about? Well, Dr. Sasser will answer that when we come back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We're talking with Dr. Charles Sasser of the Conway Physicians Group, and the topic is palliative care. And you already said you are an internist, but you also have other jobs, and one is recently being named in charge of all the palliative care for Conway Medical Center. Wow.
Yeah, this is a pretty exciting field. It's a brand new subspecialty. Many people are confused by the word palliative care and what it means. Basically, it is the care of people with life-threatening illness with a specific focus on the patient and their family and the quality of the life that they lead, their dignity, their comfort, relief of suffering, those areas. In that way, it is quite similar to hospice. So hospice and palliative care are linked by having a common philosophy. It's an interdisciplinary care, which means you don't get just a doctor. You get a nurse, a social worker, a chaplain. You may get volunteers and pharmacists and others involved in your care. And that's because people with life-threatening illness suffer from a wide array of issues that are related to their illness but may not respond to pills and surgery that doctors are trained to do. So we need help with that sort of thing. It has really taken off in hospitals primarily in this country. In 2000 there were 600, and last year there were over 1,500. So the concept has grown rapidly. And we spend a lot of time in intensive care units and with people who come in who have diagnoses of far advanced illness. They may not know it. There may be people who come in who have multiple chronic illnesses and end up on a ventilator, and the doctors can't get them off. And we then have to sit down with their families and have extended conversations about who is this person, what are their goals for life, realizing that they now are in a life-threatening situation. What do you know? What does the family know about the illness that they are suffering from? To make sure that the various subspecialties that are seeing this patient have opportunity to tell them one story so that it's clear to them exactly what's happening, and based on their understanding and what we would then fill in by our review of the records and our discussions with the subspecialist, we would be able to give them reasonable and realistic options of care and make some scientific guesses about what the consequences of their choices would be. Now, these are conversations that may go over several days as the natural history of this particular illness is unfolding. And palliative care is different from hospice in a couple of important ways. One, there's no money attached to it. There's no federal money as there is with hospice programs. So there is no governmental regulations that you follow, but it's also not a financed program of care. So almost every palliative care program in the country has some degree of financial support from the institution or from grants because it's not self-sustaining. This is low volume, high-intensity comfort care. And it really reflects on making sure that the patient is comfortable during this period of time, making sure that whatever goals they have are being addressed and being met.
We have only about 30 seconds left, but based on what you've just said, Dr. Sasser, it seems to me that palliative care certainly improves the quality of life for someone and may even give them extended life when they have the support they need to get through this terminal illness.
Palliative care can be used with anybody regardless of where they are in their illness. And there is a recent study that shows that if you compare people who just received chemotherapy for advanced cancer versus chemotherapy plus palliative care, that they live several months longer.
Well, aren't we proud then that Conway Medical Center has gone into that direction, and even prouder that they've hired you, because we can tell you care about it. Dr. Charles Sasser, thank you so much for being with us, and best wishes in this endeavor.
Thank you. I appreciate it, Diane.
This is Conway Medical Center's Bringing Better Health to Life.